Okay, I call to order the October 6th meeting of the Sawyer County Board of Health and Human Services. Cindy, can we have the roll call?
Chuck Bennett. Here. Jennifer Lavornick. Here. Carol Pearson. Dale Olson. Here. Tweed Schuman.
Here.
Dawn Pettit. Here. Lorraine Gouget. Here. Dr. Sabrina Dunlap. Present. Dale Schleter.
Here. Please stand for the Pledge of Allegiance. Okay, now we're doing audience recognition, right?
Meeting agenda.
Okay, has everybody had a chance to look over the agenda? Any changes or alterations? If not, I would ask for a motion to approve the agenda as is.
I make, Chairman.
We would have a motion and a second.
Mr. Chairman, if we want to get some comments from some of these folks who joined us tonight, I guess I would like to move item number 6 up if that's where we're going to have them. If it's going to be audience recognition, I approve the agenda as is, and I would second it.
We're going to have a separate audience recognition for people who are here concerned with the ordinance.
Okay.
Okay, everybody in favor of the agenda, say aye.
Aye.
Motion passed. Okay, now audience recognition. This first audience recognition is going to be for people who wish to speak about a subject other than the ordinance or masking or the coronavirus. So do we have anybody in the audience or virtually who would like to speak, address the Sawyer County Board of Health on any other issue that they may have in mind? Anybody?
That's good.
Okay, we'll move on. Minutes from the previous meeting.
I'll make a motion, Mr. Chairman, to approve the meeting minutes as presented.
Do I have a second?
I'll have second.
Okay, we have a motion and a second. Everybody in favor, say aye.
Aye.
Motion passed. Committee reports. Maureen?
Yeah, I'd like to update some of the things we're working on. I know I touched on some of this last time we met, but I would like to just give an update. We are in the process of bringing in homes in for COVID, people who are diagnosed positive and need that care. We're going to be setting those up now. We're in the process of doing that piece where it's a single unit home and a bigger complex to house more people. We are also with our addiction specialist. She is now serving 43 people in our community, and that's addressing the addictions that we are seeing. And we continue to offer that care for the people who need treatment and other care along that line when it comes to that need. I would also like to acknowledge that today we had a off-site testing for COVID, and we had 111 participants, Indian and non-Indian both. When that testing is offered to the community, it's for the whole community. And so there was 111 today, but this is either the 6th or 7th time we've done that off-site testing, and we've tested over 1,500 people now. And so whenever those testing opportunities are available for our community, it's for all our people. We're trying to address this pandemic. We're trying to help those who need to have that testing done. We're trying to prevent what we can, and we're trying to keep people safe. So we continue those efforts also. I know that we have our men's shelter up and running, and we're max now. I think we have even a waiting list. So we're trying to figure out a way to expand that And our women, we still are providing care for them in the women's shelter for domestic and homeless. So we're trying to provide that for our families also. And one of the things in our community too that we recognized was that the men who are single parents and who need that care. So we're trying to address that with some of the homes we're bringing in so that we can provide that to those who are either homeless or transition or wherever they're at with recovery, whatever's happening, to meet that need, because we do have fathers who have their children and then they need that placement also. So we're trying to expand in that. Our new health medical director is adjusting to our facility now and getting used to our community. So he's getting more familiar with our people and providing that care that they need. I know that we are trying to do what we can all the way around to keep working with our community on what's happening around the world. So we are going to keep putting those efforts forward. With that, I'd like to just pass it on to who's next. Thank you.
Well, thank you, Lorraine. Our community appreciates the efforts. Yeah, I have a tendency not to speak very loud. Most of the time I'm being told to shut up. Okay. No, out of order. Okay, Julia, are you ready?
Yeah, Senior Resource Center is not here.
Senior
Okay,
Resource Center
just
is not here, I'm sorry.
Wanted to validate. Alex, PowerPoint, please.
So this is Public Health Coronavirus Update.
Okay.
Julia, thank you.
Yep, and I'm Julia Lyons, Health Officer. And so the update for today, October 6th, our cumulative cases to date are 258. We have 50 that are active in our community right now. We've had 1 death and 9 that have been hospitalized at some point while they were positive. We are monitoring 78 right now, and we've had 4,768 people test negative. Some of those people have had multiple tests, depending on their vulnerabilities and needs for retesting. Next slide, please. This is a slide that is from Harvard Global Health Institute. It helps to, if you look on the other side, it helps to get the graph in there to kind of see what has happened with us. We had our big spike that was in August, and we were able to drop back down actually to a very low risk level, and now we're beginning to creep up again. So this is based on a 7-day moving average. When you hit the red level, it's any more than 25 cases per 100,000 per day. We are at 29.3. Our average actual cases that come in is on average 4.9 positive people per day at this point. Next slide. And this is a new data slide that Wisconsin has released. We have been using this map. We've done it a few different times, and it's been out for probably well over a month, maybe even 2 months. As you can see, the state is not in great position right now. The lighter blue is actually high, and then the rest of the dark blue is very high. So the entire state is having some difficulties keeping the virus in control. This is especially true in the northeastern part of the state. They're actually overrunning their hospital system, and it's been very hard to keep on top of things. Price County has had quite a few cases just recently as well, and with them bordering on us, we just need to be very vigilant on the spread and what we have going on. The good thing is that we have hired more contact tracers. They work part-time for us. They have other jobs, and/or are retired and have decided to come back to help assist with contact tracing because they felt it was important to have this in the community to help stop the spread. Next slide, please. What can we do to slow the spread? Well, things that haven't changed locally. We continue to ask you to limit your close contacts, especially when we're in a time of community spread. You know, if somebody ends up being positive here tonight, we'll be putting a notice out letting people know that they need to be watching for signs and symptoms because we will not be able to identify where everybody is in this room or the assembly room. If you're gathering with friends, the best thing to do is to do it outside and physically distance. What we're seeing for spread is typically that we want to go back to our old lives and invite people over to dinner and be in close contact. We don't wear masks when people come over to our houses. These are all things that we do, but we can spread it from one person to the next that way, and that's what we're seeing. Now is kind of that change of the weather, and we've got new things coming up in our lives, so ATVing, hunting, even though we're doing those things outside, we tend to be going to cabins or hanging out with people, and that's definitely where we're seeing the spread. So things you can do, obviously, locally, we talk about wearing masks, practicing good hand hygiene. If you're not feeling well, stay home. If you have COVID-like symptoms, get tested. And on the state side of things, we do have the masking order, and today an order came out to limit gatherings. Not really familiar with what is in that at this point. It came out this afternoon, so the next time we meet, we'll be talking more about that. Next slide. What's going well? Schools are following strategies that are allowing them to stay open. Things are going very well with the schools. We worked for a couple months before school started with all of them. I was meeting with the superintendents. We meet with the staff who monitor student symptoms. They're keeping kids out of school when they're sick. They're having people get tested. And we've had very limited amount of positive cases and or quarantine within the school systems. So we're doing very well. When we see other schools that have actually had to shut down because there's so many people out, we are considering ourselves very lucky that we have such a great team working together. The other thing that's going really well is testing in our community. We have the hotline that's set up for curbside testing. If you have symptoms or you've been notified by the health department that you're a close contact, you can call that hotline and get tested. They set up curbside for you either at Hayward Hospital and or LCO Health Center. And Lorraine already made note of this, but LCO has been doing a great job at community testing. They test about every 2 weeks. It is open to all people to repeat that. There's no charge with that. You don't need to set up an appointment. So when you see that advertised, you're welcome to go out and get tested. And we are setting up a National Guard testing site. That'll be in winter to help meet the needs of that population. And we'll be starting that on 10/21. That's going to be every Wednesday from 9 to 1 at the Winter Fire Hall. So there'll be more communications coming out on that as well. I just finished that today. Final slide, please. What are our next steps? Boy, we want to keep those kids in school. We're going to keep working with the schools. We're also going to be working with the local labs and the schools to be able to get testing on site. We are working on influenza clinics. It's going to be really important that we do a good job vaccinating for influenza, so we're not dealing with both COVID and influenza at the same time. The other thing that we will be doing as we're doing our influenza clinics is prepping for what COVID vaccination clinics will be looking like as well. That vaccine is a bit more fragile and needs to be, once it's distributed to us, we're going to need to have a quick turnaround time for administration. So we'll keep you updated as we know more on that. I already spoke about contact tracing. That is still going well in our community. However, in other communities, they're being absolutely overwhelmed by the number of positive cases that are coming in. At this point, we are connecting with everybody and able to help guide them through the process. And then communication, we're still working on our communication. We keep adding to our website and updating Facebook daily. So, that's where we're kind of focusing our time. And that is my update.
Okay, thank you, Julia. I would also like to acknowledge the Lac-Courte Public Health Officer is also here, and his Mr. Gary Gerard. I just want to acknowledge him. Thank you, Gary, for coming.
And I'd like to just add that we work closely with one another, and LCO and Public Health are on the phone every day having conversations, so.
Good question over here, Mr. Chairman.
Who had that?
So you talked about school. Is that all of the schools in our county, or were you looking specifically at Hayward?
No, actually, all the schools are on the same call. We have LCO, Hazel, Hayward, and Winter. We're all working together.
They're all doing okay?
Yep, they're all doing well. Good question. It's all the schools are doing well.
Any more questions from the board for Julia? I do have a question. When someone from your office contacts me and said I've been exposed to somebody who has tested positive, what instructions do they give me?
So, we typically, we're gonna find out that you were in close contact to somebody because they told us that, and hopefully you've already heard that that you were a close contact to that person through them. And then what we're going to do is talk with you about how to quarantine, because you would be at risk for converting to COVID between day 2 and day 14. And that's why quarantine is 14 days. So we want you to stay home, kind of stay away from others in your household, and have others go out and get you the things that you need and wait on you. How's that?
Okay, so I was one of the lucky ones that got to experience the whole quarantine positive case scenario. And I serve on some other boards within the community, and one of the questions that came up that I don't have an answer for, and that was frustrating for me, was from a business standpoint, and I know we're gonna talk about this, but it was really frustrating that when I made phone calls in, that there was no good answers as to, do I close my business? What's the cleaning protocols? You know, do I send everybody home? And that was frustrating because there wasn't any real good answer. I was basically told, do what you want. And not knowing there was going to be all these people here tonight, it was one of my main concerns that I was going to bring to the board about the importance of education to our business owners. Because it is frustrating, because you go into my business, I have a set of rules. You go into another business, they have a set of rules. And there's not really a lot of consistency. And I know I've missed the last 2 meetings because I've been out sick with COVID. And so I guess I want the board to really look at that and maybe somewhere fit in, even if it's something generic, just as a guideline, because that was really frustrating for me. We had 20 of us that were affected. And so not knowing, then really being in the dark and then being in isolation, it was really frustrating. And so, and then every time I called, I got a different contact tracer, or I got somebody else, and I didn't want to bother you personally, but it was like, they go, well, just do what you want. And it's like, well, that's not really a good answer. And then, and then I bring that back to my other boards, and it's like, I'm not getting a good answer. And so we winged it, and I don't know that that's the right way to be proactive. So that is one thing I wanted to bring up about this whole thing. And, and the importance of, I wanted to, ask, I myself got a little bit lazy too, like, okay, I've had COVID, now I don't have to mask. Well, I have now found out that's not true. And so I've been very vigilant. And if you've been through COVID, it's a different experience. I was not beforehand. I was good about doing everything, but I was like, oh, I'm a pretty healthy person, I'm not going to get sick. And I got very sick. And so I do have a little bit of a different view of it now. And we do have a family member that is in the ICU still, and he's been there for 15 days, and he was on a vent for 11 days, and he's still there. And it is very real. So, and it is in this community.
So I'll just address, and I'm sorry that you have your family member in the hospital. It's stressful. And I know that our contact tracers all, they always shed a tear when they hear that one of our residents is in the hospital. So One of the things that, and you're right, it is very confusing for businesses. I'm just going to flat out say that. Every business is so different in how they operate and who they can bring in. But it needs to be a little bit more of a focus, and we've identified that. We're going to try to figure out how to have some better information and guidance out on the website as well that the contact tracers can give. One of the key things is you asked if we would, should you shut down or not shut down, and we didn't tell you you had to shut down. And that is one of the things at this point. It's not the place. It's not the physical environment of the business that causes the business to have to shut down. When you think about other things we do in the health department and we look at the restaurant and we look at the kitchen area, that is the physical business, right? But this is us kind of spreading communicable disease from one person to the next. If you're doing your regular cleaning, and I'm just going to do this for general, and then we'll take this back and do more, but I just wanted to give you a little something. If you're doing everything you need to clean and you have other staff to bring in to work it, and everybody that needs to be in quarantine can stay out, businesses can stay open. But there have been businesses that have needed to close down because they're so small, they just don't have the staff to stay open because so many people have been impacted. But I'm glad to hear that you're bringing that forward, because I've been thinking hard on, do we need just a person that can really focus in on the businesses? And it sounds like that's a need. So you're validating my thoughts. So thank you.
Ms. Pettit.
Yeah, Lorraine.
I wanted to comment on a couple of things that you touched on, how important it is for education, because this pandemic is new to all of us. And we have to take care of all our people, no matter what age they are. And the fear that's out there, the worry that hits, the things that are happening. I just had an elder who was diagnosed and very concerned with the health conditions that he has. And what you can hear in him, that fear, and how we try to guide them and what we can to keep practicing those safety measures, keep doing those things we've been doing, keep doing that. The kids, keep doing those things. We're trying to protect you. We're trying to keep everybody safe. And in those joint efforts between the tribe and the county, we're all in the same community here, and we overlap all the time. We're always interacting. So keep those in place and keep that strong so that we can keep our community as healthy as we can and as safe as we can. We're trying to save lives here. So I think it's important that we continue that. And I just wanted to touch that the tribe we're updating our resolution that we had in place for the membership. And we want to keep reiterating those things and trying to have that in place. And it was real hard because people want to go back to that normal life. People want to go off and do things and be a part of whatever's happening. It's football season now. People like to have those gatherings. But we're trying to do it the best way we can and keep encouraging to keep doing those safety things the best way we can at this time. So I know it's real difficult to put it in place and mandate it or to do certain things when it's real hard to manage that. However, as leaders, we want that, to encourage that. So it's important. And some of those facilities, like the Boys and Girls Club, we're operating to the best we can. We touched on the schools, operating so those children have some kind of normalcy, but trying to keep those safety measures all the way around. But I just wanted to mention that because it's very important for our community, those things that you shared.
Yeah. And it is difficult, Lorraine. We're all getting tired. We're sick of COVID. We want to wake up and find out it was a bad dream, but it's still here.
Yeah.
So thank you.
Ms. Bennett?
I wanted to say that there is on the county website, there is some guidance. There is from the CDC and the Wisconsin Department of Health, and there is some business guidance, and the county can guide you, but there's no way that anybody can tell you to shut down your business. It has to be a personal decision on what you feel comfortable with, what your situation is, what your staffing is. And each positive case in each business or household that gets it is a unique situation. And everybody needs to understand that. It is not a set where we can make a rule and say, this is how it's going to be for everybody, because the circumstances are not the same for everybody. Corona is not picking and choosing that it says you get it severely, you get it mildly, or we all do it one way. So everybody needs to be understanding that we need to be Sawyer strong, as the sign says. We all need to be together. We need to work together. No one wants anybody to go out of business. No one wants anybody to die. I certainly do not want to attend the funeral of any one of you in this room or anybody up on this board. So I would ask for everybody's understanding, compassion, and empathy at this time, that we all work together. That's what our goal is. That's what Sawyer Strong is. We need to show the rest of the communities and the rest of the counties that we stuck together. We didn't turn on one another like some of the other counties are at the moment. We need to support our health and human services people. We need to support Julia, and you have to support us as your county board. We're the elected officials in. We try to do best what's for our constituents, but sometimes we're devil's advocates. We can't help everybody. Someone's always going to be, we're not on that side. So I would just ask that you consider the position we're in and Julia's in and the contact tracers and everybody. Just be understanding. That's all we're asking everybody. No one's telling you we're going to shut your business down or we're going to rip people out of homes. No one ever would do that. I personally would not allow it. I know Dr. Dunlap would not allow it. I know Mr. Schuman would not allow it. Every one of us on this board would not allow it. That's all I have to say.
Okay, thank you. Okay, now we'll move on. Beg pardon? Oh. Now we'll move on to letter B, the update on existing public health ordinance and discussion. And Tom, you're going to lead that off?
Sure, thank you. I'm Tom Haw, Sawyer County Administrator. I just want to say a few words about the process and what's happening tonight and where we're at in this whole process. Obviously, earlier this spring, everyone's lives kind of changed with the pandemic. And we have kind of learned as we've gone along here on how to handle this. So, way back in the beginning, there was a safer at home order that went out from the state. And that was followed up by Executive Order number 28 from Palm. And that decision was ultimately struck down by the Wisconsin Supreme Court, which called into question why that happened. And the ruling was that the legislative process or the administrative rule-making process wasn't followed properly when Palm made that executive order. That also called into question the local health officer and the authority that the local health officer has. Julia Lyons is our local health officer. That's different than Palm, who is the state public health officer. And their authority comes from two different spots in the statute. So the state statutes has authority given to the state public health officer, and there's a different statute that gives authority to the local health officer. So Julia Lyons and other county health officers operate by state statute. Counties are actually an arm of the state. We can't do whatever we want to do. We do what the state allows us to do by state statute. And so any of that authority that the public health officer comes, it can't be regulated by the county. It's regulated by the state and that state statute. So what are we trying to do this evening? Well, the county does have an existing public health ordinance. So that ordinance is on the books. And that ordinance is adopted by the county board. County board is a 15-member body elected by the citizens of Sawyer County. And that county board also has committees that operate. So the board is separated into different committees like public health and public works, public safety. And those committees meet and work out the details on things that are brought to the county board. So before you tonight, you're sitting before the Health and Human Services Board. And this board is a little bit different because this is also a statutory board made up of 9 members. And there's 5 members from the county board on this 9-member board and 4 members from the community. And among those 4 members, the statutes say that we have to have 1 member who receives or has received human services, 1 who's a registered nurse or physician, 1 who's a tribal representative from LCO, So those are the qualifications of the members of this board. So this 9-member board looks at things that are health-related and makes recommendations then to the county board, which can adopt ordinances. So anything that comes out of this committee would go to the county board, and the county board meeting is next Thursday evening. So any decision that comes out of this would go to that agenda and be talked about and fully decided upon by the county board. Part of that process is the public participation, and it's good to see so many interested people here, because it is an issue that obviously concerns a lot of different facets of businesses, people, citizens within the county. So I think Julia's got a couple other words to say perhaps, and then the chair would open this up for public comments and will allow people to voice their concerns about the ordinance that is before us this evening. Basically, again, the county does have an ordinance. The changes that are being contemplated in light of that Palm decision is adding a legislative oversight to any order that comes out of the local health officer. The statutes give the local health officer the authority to do a public health order. And that's, again, statutory authority. However, due to that Palm decision, some counties are contemplating giving the legislative body, that being the county board, the option of rescinding or affirming that public health order. So that's something that's not in the ordinance now, but it is in the proposed revision to the ordinance, which kind of restricts the public health, the local health officer's authority. But it does give that legislative oversight, which some people find comfort in, that there's elected officials overseeing any order that comes out. The other facet of the ordinance is the enforcement piece. There's a citation that could be issued for a violation of the ordinance. But that's the enforcement portion of the ordinance that would be added, again, due to that Palm decision and what we learned from that. So with that kind of introduction, I think people that were looking to speak have signed up, and the chair will call your name, step up to the microphone. It is important to speak clearly into the microphones because we've got people on the virtual website here too that they're having a hard time listening if we're not real close to our microphones. So I'll turn it back to the chair for further comments.
Julia.
Okay, Julia, you had a few more comments?
Yeah, just to kind of walk you through what you're looking at in front of you, starting on page 6 of the full agenda. Page 6 is where the ordinance with the revisions comes into play. And again, this is an existing ordinance, like Mr. Hoff has said. However, we did make some revisions to the beginning part, and it's page 6 through 9. When we get to, oh, I tried to lick my finger. I can't do that through a mask. When we get to 1.4, public human health hazards, that is all the original content that is in the ordinance that's already on the books. Again, I'm probably repeating a little bit, but this is what we did is under the authority. I'm just going to go through what was added so you can kind of see some of the key spots. The original order had chapters 252 and 254. We've added 251 and 254 were in there. 252 has been added for clarity in this, because we did speak about communicable disease in the original one, but we didn't reference that statute. So that statute has referenced. That's the statute that already is on the books, has been on the books for the state for over 40 years. That does give the health officer authority to write local orders. Then as we go through, 1.2 really just outlines what is in the statute. And then as you go through I'm trying to kind of find where your section is. And then it talks about the enforceability. again, that was not clearly written in the original ordinance, and so that is clearly defined if an order is written. And then the other piece, which is in here, is under C. So 1.3C gives the county board the ability to actually rescind an order that I write if it is not agreed upon that that order should be in place for the county. So those are new things that are added to this ordinance. And I believe that based on everything that Mr. Hoff has given, sets you up for review of this ordinance.
Excuse me, can I ask you a question? What do the local orders consist of? You didn't explain that.
What?
What do the local orders consist of that you mentioned?
There is no local order. A health officer can write an order.
Where are the orders? What do you have available to you?
Is it okay for me to speak back to
Yeah,
the?
but
because
for this question only, but then we're going to go to audience recognition. So I'll allow this, but no more.
So I'm not sure I'm clear on what you're asking me. I have no orders on the books right now.
Okay, thank you.
I have a question for
Yeah.
Julia. Julia, have you, in your present position, have you closed any businesses due to COVID or
No,
anything COVID-19 related thus far?
no, not on any orders that I have written. Nothing has closed businesses.
Okay. Have you issued any citations yet for
No.
COVID-19 or masking?
No citations have been issued.
Okay.
Okay, next we'll go to public recognition. We will call out your name on the sheets that you signed up to indicate that you wish to speak. Each person will have up to 3 minutes. Please keep it to the general topic and no attacks on individuals or individual businesses. Let's see, what else?
Mr. Chair?
Yes.
Just a comment, people did sign up to speak. Those that are participating virtually, if you hit *9 on your phone or the raise hand button if you're on a computer, that would notify the chair that you wish to speak and you would be called on eventually. So we got a number of speakers, so it might be a while, but either *9 or raise hand if you're on virtually.
Okay, so this is audience recognition, and we'll start with Mr. Don Laufenberg.
Excuse me, one other thing. We're here to listen. We want to hear your opinion. We will not debate your opinion. We will not question your opinion. We will just sit here and respectfully listen to your opinions. Thank you.
Don?
Thank you. I'm here tonight, along with many others, in opposition to the proposed health ordinances presented. The ordinance should be withdrawn until a broader community consensus can be reached on what they should contain. The proposed ordinance gives way too much power to the county health officer, who is not an elected official, to make these guidelines. The ordinances are vague, ambiguous, and way too overbroad, closing an entire business. Mask mandates. There's clearly a lack of clearly defined enforcement limits and insufficient legislative oversight for the county health nurse when they make these rules. We recommend the ordinances be withdrawn and taken back to the drawing board. They can be rewritten, but include businesses, healthcare people, educational institutions. They all should be consulted when you make these ordinances or these laws. Any ordinance must address the concerns noted about the current drafts, including shorter time limits and the length of emergency orders. No categorized closure sections, timely and affirmative legislative oversight, and clearly defined limits on enforcement powers and penalties. Thank you.
Thank you, sir. Okay, next we have Claudia Methvin.
Hi, I wanted to just address the fact that I received this from a legal person, that Julia is seeking the right to impose forfeitures against businesses who do not follow her orders. And right now, she has the authority to write orders, but only the law enforcement or the DA can impose them. And my next, which I think is correct, it should never be, she is not an elected official and should not have the right to be able to do that to any business, nor cite them with a ticket. That's the law enforcement's job to do. I'm also under the understanding she does not live in Sawyer County. If I'm wrong, somebody can please tell me and let me know that, but I do not understand how anybody can be given that kind of power who does not even live in our county. This person should be living in our county and addressing our county's issues alone and should be part of the community. Thank you.
Thank you. Okay.
Okay, next, Courtney Guyette. Is saying that right? Courtney?
Okay, so my biggest thing is I run Snap Fitness, and we have people who have disabilities that they can't sit there and run with a mask on. Like with me, I have PTSD. I can't have a mask on. It's hard. So how can she be able to find someone who can't wear a mask? But she can't ask us because that's violating HIPAA. So it needs to be rewritten and redone all over again because she's violating our personal issues. Thank you, guys.
Okay, okay, Brett Bakley.
Good evening. Everything I was going to say basically was just spoken from the last two people. I just do not believe, and I am not a business owner, but I do not believe that anybody should be given the right that's not an elected official to have any sort of these mandates, power, any of that. That is why we elected you. We trust you. You should be doing these decisions, especially the right to impose forfeitures against a business. That right now, my understanding, falls under the DA and the sheriff's jurisdiction. Both of them are elected officials, and I think that's where it should stay. Thank you.
Okay, Peggy Dobbs. Okay. Chelsea Tremblay.
All right. Okay, so to be honest, I thought it was kind of an option if you wrote your name down. So I have nothing prepared, but I can speak a little bit about our business's personal experience with this. We have businesses in 2 other counties. Our experience with the health departments there has been totally different than the experience with the health department here. They have been much more helpful to us, like telling us what to do, giving us an individual experience because each business is different. Our experience here after the Supreme Court passed the pretty much overturned Evers or their health department thing, we called the health department. We tried to get through to Julia or our health inspector a couple of times, which we didn't really have to do. I mean, they gave us the freedom to open. We did not get a call back. No one talked to us. No one gave us any guidelines, nothing. And it's not only that, our employees had the same thing. They would come to me saying, my friend has COVID, or I was camping and someone had COVID, should I come to work? And I'd say, well, did you talk to the health department? Did someone call you? The answer was always no. And so it was left to me to decide, and that just seems not right. So I guess when I hear about more power going to them, it doesn't make sense to me when they don't even have time to tell us what the rules are or help guide us. I don't know how they have the time to deal with more power, and especially more power to enforce things that we don't even know. We haven't even had the guidelines to begin with. So that's all I'll say.
Okay. Okay, Don Hogue. Don Hogue.
Don Huff, thank you.
So,
Thank you for having this meeting this evening. One of the things I'd like to discuss here and speak up about is how we may be getting the cart before the horse on this whole issue. I'm formerly a state inspector for the last 21 years. I've done hundreds and hundreds of inspections, and I've written forfeitures in the construction field. I'm aware of a lot of the work that the Department of Health does, and I have worked with them off and on over the years. The reason I say that is because when we are involved in any kind of procedure of writing orders or addressing issues with the code, it is because it is the code. We have to make sure that it is based on our statutes in the Wisconsin statutes. Everything has to be there. It has to be firm, solid. We cannot use generic code sections to write up orders on any individual. And it just seems like in regards to this ordinance, this local ordinance here that we're involved with, it seems like it's not based on anything that's got any firm ground. It seems like this is a very contested area, all the way up to the Supreme Court. I believe that the best procedure that we have is to take a step back and take a serious look at where we're going with this. We could very easily have fines and penalties being issued to businesses in our communities here, and really very little to base it on currently. That may not and probably will not stand up in court. The fines alone, you don't need to shut down a business. The fines alone can do that if they're compounded daily. So I believe that this is an issue that really needs to be firmly addressed. It needs to be relooked at. We need to get some professional people in here to help us to get through this. And because it is a political issue too in many ways, I don't believe the timing here is right for this type of procedure. Thank you.
Okay, Billy Joe Saban.
I'm a business owner in the Hayward, downtown Main Street, and I would just like to say to you all that we have worked very hard through this pandemic. It's very hard owning a business in this community during this time with all of the tourists that have come to our area. And we at Anglers have worked daily from the time we open to the time we close to make sure our customers and our staff is safe. We got a notice in the mail because we weren't wearing masks, and we put them on for 3 weeks to follow the guideline for the mask mandate, and I had 3 servers that about passed out from wearing them. We are busy there. It's hard to wear them when you're working and you're hustling like our staff does to keep up. So I gave them the option, as it should be, whether they wanted to wear them or not. It should be a self-choice, not somebody telling us that we have to wear them. We all know COVID is here. We know the virus is real. We are in this together. We're not, this mandate or this ordinance
to give more authority is dividing us even more. And we are all here because of it. And we hope that you are listening to us and why we are here, and that this would be dropped tonight as it has been dropped in other communities. They have tried to do the same thing, and it's unconstitutional. Thank you.
John Detloff.
I'm a 48-year resident of this county and a longtime business owner for 36 years. We take the COVID issue very seriously with our business. We've chosen to do many things that go beyond what the recommendations and guidance, has presented with us. I treasure that freedom to make those kind of decisions. We voluntarily took a certain amount of loss in our business just to do what we thought was right. But this ordinance, these are unfamiliar waters that we were treading in, and I strongly caution the county board against passing a resolution or order that may infringe on our civil liberties and freedoms that our Constitution guarantees. This section 1.2C, I do believe gives the county health officer far too much power. I believe parts of it are vague, and it's a very troubling thing. I've learned a lot from listening to Julia Lyons, and I appreciate having her in her position, but she's not going to always be here. Somebody else is going to have that position at some point in the future, and when regulations give an individual that much power, that person can be in a position to abuse that power. I treasure the guidance and advice that Julia Lyons has given us. I've learned a lot, as I said, but I'm very concerned about overreaching regulations, and that's a very big concern of mine. Thank you.
Okay, Brenda Detloff.
Well, first of all, I want to say that just about everything I already had, they've already said just about everything I wanted to say, except I'm likely the only person in this room that had I had major heart surgery in April. So I'm high risk. So I personally have taken myself out of the mix. I don't expect everybody else to take themselves out of the mix. I knew I was higher risk. That's why I'm wearing an N95 mask. That's my personal choice, and I know I'm at risk. But why should somebody else who doesn't have a health concern, why should they be put in the same boat that I'm in? And I would like to remind the Health and Human Services that their mission statement states to respond to health and safety of Sawyer County residents and promote the self-sufficiency and general welfare of the individual and the community. And this is from the CDC because these are things that people haven't mentioned yet. They list in underlying conditions is meant to inform clinicians to help them provide the best care possible for patients and to inform individuals as to what their level of risk may be so that they can make individual decisions about their illness prevention, which is what I chose to do. And we as a business, we closed our business to the public because of my health concern. We took a loss. We knew that I was high risk. So you can't make every person do the exact same thing, and we wouldn't expect every business to do that. But we chose to do that because that's our civil liberty right, is to make our own decisions. And you cannot, this is unconstitutional. You can't make everybody abide by the same, ordinance that she's going to apply. You can't do that. It's not fair. So that's all I have.
Okay, Richard Richter. Richard Richter.
So many of my current concerns have actually been addressed by a number of the other business owners here tonight. So I'd cede most of my time to the next speaker. However, in listening to this, I guess I'm most disappointed in this board's unwillingness to answer questions or debate the current concerns with people here tonight. So that's all I've got to say.
Okay, Peter Methvin.
Hello, my name is Peter Methvin. I'm a Sawyer County resident. Unlike Ms. Lyons, who I just heard is not a resident of this county. I don't know how that works. I don't know how you would allow that, but anyway, that's a different issue. The purpose of me being here and the purpose of all of us being here is to urge the board, this committee, and ultimately the county board to vote the right way. We cannot give an unelected official the kind of power that she is trying to pull. Because you have to remember that power tends to corrupt, and absolute power, it corrupts absolutely. Thank you.
Okay, Scott Turnbull.
Good evening, and I just want to say thanks to all of you for holding this meeting at a time when we could have a chance to come in and speak, so thank you. I'm not going to come here and dispute the statute 252. That's is what it is. My questions that I have and concerns are, one, that this position is an unelected official. That's very troublesome. This person is unbound by the Constitution of the United States. And I had heard earlier, I was in the other room listening, and that there had been no closures, et cetera, and no tickets written, et cetera, in the past. So one would argue that, then why do we need the ordinance? Moving on to the opportunity to rescind this position or this ordinance by the county board. If I'm correct, does that have to be a supermajority?
2/3.
2/3 majority. That bothers me. I would really like to see this committee, this board, move to the county board that you don't need a supermajority. I would a 2/3 majority to rescind anything. I also believe that the full board should ratify any and all orders or closures on that simple majority. I'd like our officials that we've elected to be on record with each one of these decisions, so that us, the taxpayers, can make our choices in the ballot box. Now, for 32 years, I've tried to convince my wife that I was a doctor. She hasn't believed me. So I'm not going to try to come here and pretend that I am. But I do know suicides, addiction, mental health is on the rise. And though we may hear different experts here and there, the majority of experts say a lot of this is due to the shut-ins and the closures and the lockdowns of people being at home. So I pray that you all consider that. We've had this talk about mental health for years now, and I'd like to see our county take charge of that and really run with that. Now, we have 16,000 to 17,000 people in Sawyer County, if I'm not mistaken, somewhere in there. Well, if you just take that amount and you have our 258 cases, that's 0.015% of this county. Okay, that's pretty. I'm not saying it's not real. I'm not saying it's not true. I'm not saying it doesn't devastate people. But that brings me to my next kind of point here is, I sit on our church council, And I can't tell you the amount of meetings we've had since the beginning to make sure we're protecting our people, our congregation. We're following a lot of the protocol that we're supposed to do, to the point we even, shut our church down briefly. And that caused a lot of hurt amongst our congregation. But I will tell you this, in every one of those committee meetings, we prayed extensively for our Sawyer County Board, these committees that make these decisions, and we will continue to do so. Common sense, public safety, economy, we can balance that. I'm sure we can. But you have to do that by making that entire county board look at each one of these ordinances and orders. They have to have the ultimate authority in this. I would love to see every board member on record with every one of these decisions. That's all I have. Thank you very much.
Okay, Taylor Johnson. Taylor Johnson.
Hello. My name's Taylor Johnson. I'm not a resident of this county, but I do all my business up here for the most part. And I just wanted to say a couple things. I almost passed, but we keep getting all these ideas and all these rules coming from Madison and bigger places way south of here. And all this blanket legislation and these ideas, they don't fit here. We they're asking us not to believe our own eyes and ears. And when you have rules coming from there, it's just not the same. It doesn't fit here. You look at how they handle a lot of things, how they treat their people, their police officers, their businesses. It's not for here. So just consider those things when you make a decision. We're not Milwaukee, we're not Madison, we're northern Wisconsin. And if we make decisions like that, we're going to look like the UP of Michigan if this keeps on, because businesses are struggling. And we won't know the extent of that until this coming spring next summer. And that's all I have to say.
Okay, that's all we have on our list. Alex, is there anyone virtually that would like to speak? You can. Okay, go ahead. Do you have to unmute them or anything, Alex? Do we have a name or a number? Helen? Alan. Ellen. Okay, Ellen, you may speak now.
Okay. Whoop. Okay, now can you hear me?
Yes, we can hear you.
Okay, very good. Say, I'm just a concerned citizen who does live in Sawyer County, and I feel that our health officers should have the right to direct us as to what keeps all of us healthy. Apparently, we all like what she currently is doing with the schools and testing, doing all of the COVID testing that's happening at all of the different locations. And kudos to her, she stayed on top of it. She's got enough people so far helping her with these issues that I think it's going in the right direction. But I also want to say this is a first for all of us. It's a pandemic, and we need leadership and direction. And apparently, she's showing us that right now in our schools, in all of the testing we're doing. Yet, as businesses, we seem to fear that she maybe cares a lot about us, that we should all maybe be wearing masks so that we're not spreading the COVID. Whether or not you have it or I have it is beside the point. I would like to remain safe and healthy as I would like you to. And I think that if the numbers continue to go up like we're seeing in our state currently, businesses are going to be forced to be closed because everybody's going to have it. So if we don't wear a mask now, just to keep everybody healthy and safe and to help keep our businesses open, I think we're kind of defeating the purpose. I know it's very, very hard trying to be safe, but I also feel it's necessary for us to be alerted when things do happen. For example, if there is a COVID outbreak in a school, we would know about that because the school is going to shut down or it's going to be isolated, and those children or staff or whomever will be removed from the school, quarantined, whatever. We will know about that. But you know, if there's an outbreak in a business, why shouldn't I know that? I am a patron to every one of your businesses. And if there was an outbreak and I didn't know about it, and then I got COVID because of the aloofness of certain people, that would really be an infringement on my right as a citizen in this county. So I just think it's really, really important that we think about this and think about the safety of everybody, not just business owners, not just elected officials, not just concerned citizens, but everybody, regardless of where we live. We have many, many people coming here from many different areas, outside of the state, within the state. I just personally would like to see everyone stay healthy and safe. This will pass. This pandemic will eventually slow down, or we will get a handle on it with a vaccine at some point. But you know, at this point, when I'm out and about, and if I see somebody without a mask, let's say it's in a store or in a restaurant, I have to tell you, I turn around and walk out, not only for the safety of myself, but the safety for everybody else. It's like, I don't know if that person's infected. They don't know if I'm infected. I really think it's giving us a sign of unhealthy conditions. Why are we so afraid to wear a mask? That doesn't make your business or your person any more or less respected. Wearing a mask really is what's going to help keep all of us safe. And my other
Okay,
point.
thank you, Ellen.
Okay.
Yeah, what is your full name, Ellen?
My name is Ellen Domask, D-O-M-A-S-K.
Thank you, Ellen.
Well,
Okay.
All right, no,
Okay.
no, quiet down, be respectful, everybody.
Okay, next
Be
we have
respectful.
Tim Warner. I'm sorry, I missed Tim earlier.
Good evening. Greetings to you all. Thank you for serving in the places that you do. Many things that I was going to share, I won't because they have been said, but just two things. A, common sense. We need a good dose of common sense. At first, when I talked to many people, business owners, doctors, dentists, that kind of thing, there were laws made, there were statements made, there were mandates, no specifics, no clarity. And so at first I thought that was sort of a bad thing. As I considered it and as I talked to those people, they did far better on their own as any law or jurisdiction or person of authority could do that. And I think that was probably a good thing and a good testimony to our people who are serving in those areas. The second thing is that we have a lot of things that divide us. Everything from religion to politics to economics to personal feelings and several other ways. And I think if you pursue this path, you'll take people as a community. I think we do pretty well up here. I've been a taxpayer for 38 years in the city. And so I think we do pretty well. If we pass legislation like that which is proposed, if I understand it correctly, I think it will further divide people. I think it will cause snitch on your neighbor and those kind of things to be intact rather than being supportive. We'd be further divided. And I think it would be better to make statements and give people the freedom and acknowledge the conscience and intelligibility that people have so that we can serve together, walk together, work together in this community. Thank you.
Okay, Aaron Morrison.
Hi, I was not planning on speaking tonight at all. I am not a resident of Sawyer County, but I'm a resident of a neighboring county. And I just wanted to listen to this meeting tonight and see what it was going to be like. And now I just feel compelled to speak. Some notes I took, just things that I wanted to say is that I am a retired public health nurse. I am still connected to the field of public health in the state of Wisconsin. And many people have brought up that the health officer is not an elected official. There's a reason for that, and that is that it's a high area of expertise, and that person needs specific training in all aspects, not just a pandemic, but all aspects of public health. And the person should be hired by board through their qualifications and not be an elected official, in my opinion, in the field of public health. Because you want someone that has the expertise to be able to really understand the ramifications of all of the health issues that we face as a community. The other thing that I've learned is I'm a seasoned person, and that is that oftentimes meetings like this bring forth a vocal minority. And I just want to make that statement because I don't think that the opinions of the broader community are really being reflected in this meeting. The other thing that I want to say is that it is a public meeting, absolutely, and that's why I'm here. And the other thing that I wanted to say is I live in a neighboring community.
Quiet, please, and let her speak. Be respectful.
I live in a neighboring community in a neighboring county. I have friends that live here full-time. I have friends that come and have cabins and vacation here. I have friends that come here from all over the world. And I had friends that are family, and I have friends that are business owners, because I've been connected to this whole general area for a really long time. And I will say that there are lots of things that happen in a community. You have voiced your opinions and your thoughts about what's happening in your community, but I'm going to represent a voice of some of the feelings and observations of people who don't belong to this community. And one of those things is what's going on in Hayward, what's happening, and why are people unwilling to do what's just a temporary thing for the safety of people around them. And you have residents of neighboring communities who refuse to come here because of what they see in the city of Hayward. And so I'm just offering that perspective as well, because I don't think that has been represented tonight.
Thank you, Erin. Thank you.
And the other thing that I would like to share is through my connections with people and with public health. One thing about Sawyer County that you have going for you, you have many things going for you, but in relation to the pandemic is that Sawyer County has been pointed out as one of the best places to get tested and to have adequate follow-up. And there are a lot of people who come from other counties to this county because of the excellent follow-up that they have in this community. So don't sell your health officer and all of the hardworking public health nurses that are out there trying to work on this pandemic to keep you and others safe. Because that's what I hear.
Thank you,
And
Erin.
I'm done. You're welcome.
Okay. Alex? Alex, we have one more virtually. Who is that? Christine, you're next. If you could state your full name for us, please.
Yes, can you hear me?
We
Hello?
can hear you.
Okay, my name is Christine Righeimer. I'm a resident of Sawyer County and taxpayer in the county for 17 years. I'm a retired lawyer in the state of Illinois, but I do know some Wisconsin law as well. I'd like to start out first. I do want to applaud Julia, because for Julia, we do know she's doing a good job at what she's doing. And I don't think by saying this ordinance shouldn't be passed, anybody's saying she's doing a bad job, and I would like to stress that. But I would point out that the Wisconsin court, in fact, overturned Governor Evers' order because they determined that the power given to the health department, that the person that issued the order did not have that power, that they exceeded their power. It sounds like maybe this might be going down the same path of giving someone too much power. That someone at the Wisconsin Supreme Court even commented on the fact that a non-elected official had the authority to govern the state and shut down business, and that was one of the reasons they overturned the order. You know, this isn't an issue of safety. I don't think everyone agrees that we want to be safe. But it is an issue of government overreach and a country where we're based on individual freedom. The Constitution's written to limit government and not individuals who can make their own decisions. In my opinion, my personal opinion, I'm not giving anybody legal opinions, I do not believe the state or the county has the authority to interfere with a person's freedom of movement or freedom to wear a mask. But only has the authority to mandate wearing a mask on government property. So I think one of the other things that the council needs to think about too is all of the lawsuits that have been taking place across the state and various counties that have rescinded a lot of ordinances because they cannot afford the lawsuits that inevitably come from the overreach of government and things like this, especially involving COVID. And ultimately, that's the taxpayers that are then paying to defend lawsuits, and it's coming out of their pocket. So I do think that issuing this ordinance would open the county up to lawsuits that it would be money better spent in other ways to promote the safety of the community. So,
Okay, thank you. Thank you, Christine.
Yep, that's all I
Appreciate
have to
that.
say. Thank you.
Yep. Okay, is there, Alex, anyone else? Nope. Okay, I think we've gone through them all, Mr. Chairman. We'll open it up for board discussion now.
Okay. First of all, did we miss anybody who was signed up? No, we're done. Thank you, sir. Okay. Where's the,
Okay.
Okay, I'll open it up for board discussion, comments.
I have no problem.
Pardon?
I will.
If she wants to pass her resolution like she does, and the sheriff's department has to enforce that, where does that money come from? It's not federally funded. Is that coming from the county? That's gonna pay them to do their job? Or is that are you just gonna raise our taxes more?
It's going to,
You know, I'm sorry, but I got a strict question right there, and I'd like to know an answer, because I don't think that's right. Right now, the sheriff's department is not funded to enforce the law, okay? If you want to pass that, is the county already took a $1 million hit because they had no money last year for this year.
okay.
So where is that money going to come from?
Could you state your name, please, sir? for us?
Richard Kipp.
Richard Kipp.
I'd just like to know where that money's going to come from, because I don't want my taxes going up.
Thank you.
We're working on the budget.
Thank you.
Yep.
Any comments from the board?
Okay. Well, I guess I have a comment then. I'll go first. In what we've just heard and what Julia currently has within the ordinance, that are, in my opinion, we're probably really not ready to pass this. I think it needs more discussion. I think we need to think it through. I know it's important, but Julia already has authority in what she has now. These are just revisions that we wanted to look at. So I guess I would make a motion then that we postpone this, not indefinitely, but maybe we look at it in 2 to 3 months again, run it through discussion, run it through this committee again, and then we'll bring it back if necessary. So my motion, Mr. Chairman, is to postpone for 2 to 3 months.
Do we have a second?
Mr. Chair. I'll second it for discussion purposes.
Okay. Further discussion? Do you have any discussion?
I do. I'd like to get my comments at least out there because, you know, I've gotten more feedback on this than any other issue we've had. And I think Ms. Lyons has done a tremendous job in a critical situation. And I might add that when I was elected in May, I asked Ms. Lyons to tread lightly with the power that she was granted under 251 and 252, and I think she has. I will also say that if I don't want to get sick, I don't go out, or I wear a mask, I bathe in hand sanitizer. If you don't wear a mask and you get sick, you don't have anybody else to blame. You know, it's tough as Midwesterners, you get that knee-jerk reaction to shake hands with people. You can't do it anymore. It's probably the new norm. I just believe that it's objectionable that we're looking at this as a resolution tonight when we set up these chairs and I'm seated within 6 feet of people, 3 of them, that I don't come into contact with on a daily basis. We have to do our own due diligence at home first before we start telling everybody else to do it. Let's take care of things for ourselves. So I don't want Sawyer County to be hoisted by our own petard in the fact that I think we should maybe not vote down this resolution, but not support it. Thank you.
Mr. Van Etten.
I agree. This went up and I don't know how this worked. Mr. Hoff can maybe tell me, but I sit on the Public Safety Board and we also had this and we also discussed this and we also said it should be in the wheelhouse of the sheriff. We did not say that this should be, let me give you a background. I'm a 26-year Marine, then law enforcement, and I believe in the Constitution. I also agree with everybody's right to come here and talk. We can't engage with you. That's the problem. If this was a public forum or a town hall meeting or something like that, absolutely. But we have rules, and I have to sit here and I can listen to you, and then I have to get permission to even speak. So I agree, and I really don't even think this should be up for discussion. This ordinance, yes, there is one on the books, and I don't know how many times in the last 40 years it's even been used. Why we're going to do this now, I have no idea. I say we wait. If Julia has the power under the state statute, then so be it. It's under the state statute, not under a county ordinance. If it's a county ordinance, I believe it should be the sheriff.
All right.
I want to reiterate the piece about the education, and I don't know how that fits in with all of it, but I do think that's an important piece, and hearing from other people in the group that I personally feel like it's lacking, and so if I feel that way, I'm sure there's other people that feel that way, and I know that I can go out there and I can seek out the information, and I did, but if you're home and you're quarantined and you're sick and you got sick kids and you got sick parents, and that's not where your focus is. You're just trying to keep your business open. I mean, for me, it was trying to get somebody, I had to bring people in from out of town to work and keep my business going. And so for me, I would like to see that education piece, aside from any of the citations or rules, whatever, but I would really like this board to put its minds together and get a good piece, work with our county health nurse, and get some good education materials out there for our community, whether it's businesses or school or just people that need and want the education.
Ms. Barrett?
First, it's not a public lynching of the public health nurse. Absolutely not. I think she's doing an outstanding job. From my understanding, she's an employee of the county. She doesn't have to live in our county to be an employee. That would mean that if you came from outside, if anybody worked in your businesses, they couldn't work here if they worked outside the county. They lived outside the county. That's something you guys got to think about when you make statements. And we have to. She's an county employee. She deserves the respect she has earned. She's gone to school. She's earned her stripes. And her word has weight on this board. So I want to commend her, and I will not go for disrespect of her or anyone on this board at all. Just, I understand you're voicing your concerns. We also have to take in, there is the minority that is not here, that we get literally 30 to 40 emails sometimes a day, because I have constituents that are in the elder population on the southern end, they are not in Hayward, that cannot go out to fish fry on a Friday night because restaurants or certain entities are serving a certain demographic or age group. And they deserve to be able to go out for their fish fry or to eat or to go grocery shopping and not having to worry about it. And you guys have to understand, we have to take that in consideration also. And I think the reason why it's coming up, because there is a lot of that going on, and they have to get out of the house too, and they like to once in a while. So we have to listen to that too when I have people saying they can't go to the store, they can't go to fish fry. That's all.
Dr. Dunlop?
Right, so I've been in this community now for 22 years, and there was a comment earlier about the involvement of getting the involvement of the medical community. Julia has worked, we have since the very beginning of COVID, she has worked extensively with the medical community, and I think you have the support of the medical community. I also want to say that I'm a little bit protective of the hospital because we are a small group. If anybody gets sick because they have a child who works in a restaurant, and I'm speaking from personal experience, a child who works in a restaurant where there were not masks and they get sick, and she happened to also be babysitting for one of my other physicians in the community, you can shut down the medical community. Then you can't come into the hospital and get care for your stroke or for your diabetes or for your perforated diverticulitis. So it's not just the freedom to wear masks, it's also the freedom to keep everybody else in the medical community safe. So I think you did have the support of the medical community as far as I know, but I also would agree that it sounds like in hearing everybody's comments here, we need to go back and rework some of the ordinance to more fully take those comments into consideration.
Great.
So I would agree with that.
Okay, any more comments from the board?
Oh, right.
Yeah, I'd like to make a comment. I was listening to everybody speak and where the concerns are at. But I also want to remind everybody that this pandemic, very serious. We have not even seen the worst of it yet. I do not know what it's going to look like. I do not want to wait to see for that to happen. We start seeing our people dying. I do not want to wait to see for our hospitals not be able to take care for them. I do not want to wait to see when we can't even live. Our businesses are important. We know that in our community. That's how we survive. We are trying to save lives. I commend those who are in our community who are trying to help us address this. Very difficult job all the way around. And we are trying to do everything that we can. I read 2 letters before I came to this meeting by 2 health officials, or I wouldn't say officials, 2 health providers, stressing the importance of the seriousness of this disease. Do not lose sight of that. It is here. It's around the world. People can downplay that. People can do whatever they want. People can say, oh, it's not just going to be gone. No, we don't know that. It's the unknown. We do not know that. So we have got to do what we can to stay strong and healthy all the way around. So then your business can continue. Because what good is your business when people are dying all around you? You will not make nothing then. None of you will. We watch you to be successful. We know how hard this has been on everybody. We're all trying to survive here, but we cannot lose sight of that. So those two health officials, our health providers made strong statements. I wish I could have printed that off to read to you, but I didn't get a chance to copy it before I left. Maybe at some point we can get that out there. Very strong letters, and I want you to read that if you can sometime. I don't know how we can do that to make it public so that the people can remember some things. And we are hearing everybody what they're saying. And I agree, Tweed, we have to take a look at things closer so that we can do things, get things done, but try to take care of everybody the best way we can. So I support that. But remember, a gentleman in the audience mentioned prayer. How important it is that we all pray the way we've been taught to get through this pandemic. We need the good Lord's help. We need his help more than anything to get through this for all of our people. Thank you.
Thank you. Okay, any more comments, or I'll call the question. The motion is to postpone this for
Yes.
a uncertain period of time, or?
I said 2 to 3 months, yeah, so
2 to
we
3
can look at
months.
it.
Everybody in favor, say aye.
Aye.
Anybody opposed, same sign. Motion passed. Okay, moving on to budget, 2021 budget. Beg pardon? Yeah, it's gonna take them that long to get out of here.
Good thinking.
I swear,
Oh, that's the,
I swear
that's the public.
that
You did a
group,
great job.
that public lowers the average IQ of this county. I mean, some of the statements they were making were just ridiculous. The working people in
Should
this
have called on
county.
the sheriff.
Hmm?
Should have called on the sheriff.
Is he here?
Yeah, right there.
Oh, okay. Oh, there he is.
Doug, we never saw you. I would have called on you.
So, look. I was looking
Look at
for
him,
him.
it's nice he had those guys here.
Yeah, well, better to be prepared and
Yep.
not have a
Yep.
need than unprepared and have a need. I was
Thank you,
looking,
Patty. Very nice job.
yeah, I was looking around for him because if I had heard one more outburst, I was gonna say, that's it. If you cannot show this, if you cannot show respect, audience participation is over.
Yep.
Yeah, go ahead.
Dale? Dale?
Who wants to? Hey, let's get started here. Okay, 2021 budget. Who wants? Imagine.
Are we rolling?
Yes.
Okay, we have on the agenda the 2021 budget. Since in the October board meeting, county board meeting, I'll be turning the administrator's budget over to the county board for their discretion and for their review and adoption in November. So there hasn't been any changes on the Health and Human Services side since the last time we talked, but do keep in mind the severe expenses we incur for mental health out of county placements and what we did to address that in the budget. So that is one of those budgeted items that the county is responsible for but really has no control over. And we are planning to use some fund balance to pay for that amount that we have unbudgeted for that expense in the 2021 budget. And that's probably the most significant thing. We haven't changed the level of services. We did eliminate 2 positions in the budget, 1 or 2, to get as balanced as we could, and we talked about that last time too. So I can entertain any questions that you may have at this point. But what we talked about last month is going to be submitted with the rest of the county budget next week at the county board.
Is there funding now that has come in to add like these contact tracers and all of that? That there's been funding for that?
Yeah, any positions that we have added and are doing, we're doing that out of funds that have come in. So we're maintaining budget neutrality when it comes to adding things for COVID.
And how many contact tracers are there right now?
So I have teams that are kind of doing multiple things. So if we looked at full FTE, I can look at people. I have 1, 2, 3. I have 4 that are part-time that have other jobs, and they just kind of fill in per diem. And then I have a part-time public health nurse that's come back. I have a volunteer that's on staff that works about 15 hours a week. We're kind of piecemealing it together. And then our nurses, we have 3 nurses that we have on staff that do some contact tracing, but we also have other public health things to do.
Yeah, I was gonna say they have other duties.
Yeah, but it's all based on, we haven't hired anybody out of county funds that would have to be funding COVID. It's all being funded through additional grant money we're getting.
Okay. Well, and I will just say, like, my experience with the contact tracers, they did a really nice job. And she told me over and over again, she said, thank you so much for being cooperative. She said, you would not believe how many people in this county are not cooperative with this process. And her and I had a nice, about 10-minute conversation about that. And I actually was pretty like disappointed.
Excuse me, we're on the budget.
No, I know, but I'm gonna just add that in, because I thought it was very important, so.
What you said
And I'm
earlier.
glad that that's a budget neutral thing, because that could really.
Any other questions for Tom about the 2021 budget? Okay, how about the budget performance report? That's all in our packets. Anything you want to add, Patty?
The only thing that I can say is that, COVID's basically thrown us for a loop as it has for everything else. I mean, we have some programs that are going through the roof as far as people coming in and wanting to access them, and some that are totally on hold. We just, I can tell you that along with your purchase service recap, we currently have 3 people that look like they aren't coming out of Winnebago for the rest of the year. 3 now, with the 4th one possibly going, we were told today in our management meeting. The state of Wisconsin does want 1 person out of there very badly, but we can't find anybody that will even possibly work with us on setting up an alternative placement.
Well, now they know how we feel.
Yeah, so, yes, right now there's, mental health crisis is real right now. That's all I can say. Do you know the answer to that, Paul? I mean, I would. Yes.
I don't know. I think it's mostly adults with Joe. I could check with them, but there certainly are some issues with some of the kids, but I think it's primarily the adults.
So at this point in time, I really can't say where we're gonna come out, because that's an ever-evolving issue, because 1 person in Winnebago can blow the budget anywhere else that you try to save the money.
Okay. Purchase services recap, we just talked about that.
And that just gives you the detail of the big budget items that's in your.
Any items for discussion only?
Yeah, I'd like to make a quick comment. Cindy leaned over and said something to me, and I went, well, maybe I missed an opportunity about discussing Julia and the comments about that she doesn't live in the county and all that stuff. And I think you all know this. It's really hard to recruit and retain employees here. And we have multiple employees that work out of county. And I wish I would have said this to all these people in here. We got really damn lucky that we got her, because we weren't getting any applications. We weren't getting any applications, and she just dropped out of the heavens. It really seemed like that. All of a sudden, she was here. She called. Rose is all excited. I was excited. We interviewed, bam, we got lucky. And we even had the public health officer from Price County be a part of the interview, and she goes, hire her. You got lucky.
Really thinking that she was wishing that she.
Well, yeah, right now, but.
You think she came from hell of heaven?
Came from hell. But I just want to say we are really lucky, and she's in a hard place, having to deal with all this back and forth from the public. But for what it's worth, you got all my support. Thank you for being here.
Mr. Chair,
Yes.
Helen Dennis had her hand raised earlier and didn't have a chance to speak. If you wanted to entertain thoughts of letting her speak.
Helen, you still there? Helen? I didn't know she was. It never showed up on the screen.
I don't have anybody now. Is it now?
I don't have anybody now. I don't see anything.
Helen, can you hear us?
Well, if not, that's fine. I did want to reiterate too on the people that we hire. We hire on qualifications. They got rid of residency requirements in state statutes. I believe that was the Act 10 stuff that did away with that. So we actually can't require residency for employees. And I second the comment that Paul made, that we did get a good candidate, a good qualified candidate, and we're happy to have Julia Lyons as our public health officer. Thank you.